I'm Anmoheen. Again here with a very interesting topic of pregnancy of unknown location. The resources are NICE guideline and strategy. I will be uploading all the guidelines related to the early pregnancy module one by one. If you want more videos for your preparation, please like, share and subscribe and turn on the notification to get notified for the new videos. Now coming to the pregnancy of unknown location. So if you master only this slide, you would be able to take all your exams, including your MRCOG theory, FCPS clinical and theory, as well as an IMM. Also, it would be very easy for you to handle your patients in your routine clinical practice. So if you get a patient with a pregnancy of unknown location, means her pregnancy test is positive, but on ultrasound there is no intra or extrauterine pregnancy located. So for these patients, if there is mild PV bleeding, mild pain, or the patients are stable, you have to do the beta HCG there and then you have to repeat it after 48 hours. So you will be having three of the options. Either you would be having increase in the beta HCG and that increase would be more than 63%, or you would be having less than 50% decline or less than 50% rise, 63% rise, or more than 50%. I will be coming to all of them one by one. First, focus on this flow chart. If you get a patient and her beta HCG increases more than 63%, it means at first the beta HCG was, let's suppose, 1000, and later on the beta HCG was increased to more than 63%. How you will calculate this 63% rise? The beta HCG at 0 hours and the beta HCG is at 48 hours. Okay, so you have to minus the highest from the lowest and then divide it by the highest, multiply by 100. In this way, highest value minus lowest divided by highest, multiply by 100. In this way you will get the percentage of incline or decline. Okay, now if the rise is more than 63%, this is most likely an intrauterine pregnancy. Now you have to tell this patient that I need to give you another appointment to check for the location of the pregnancy. So for that we will be offering you a transvaginal scan that most likely we would be doing after a week or two, or we can perform it earlier if the beta HCG is more than or equal to 1500, because most likely the pregnancy can be located on the ultrasound if the beta HCG is more than 1500 or more than or equal to 1500. So we have two options: either a viable intrauterine pregnancy is confirmed, or still we are not able to see the intrauterine pregnancy. So we have to refer this patient immediately to a senior gynecologist. The other scenario is there is not a more than 50% decline. It means that the beta HCG is falling but the decline is less than 50%. Or the beta HCG is rising but the incline is less than 63%. Because if the incline is more than 63%, it is likely to be an intrauterine pregnancy. So for these patients, we are now suspicious of an ectopic pregnancy. So what we will do, we will ask them to review within the 24 hours in the early pregnancy assessment unit, and what we would do there to repeat the transvaginal scan. So either the transvaginal scan will confirm the viable intrauterine pregnancy, or the viable intrauterine pregnancy will not be confirmed. So here we are again suspicious of an ectopic pregnancy. But if the patient is stable, we can give patient the chance to take the third beta HCG. If the third beta HCG is falling, then we can do the conservative management until the beta HCG is less than 5. This is your MRCOG 2 question. But if the beta HCG is rising or is stable, that it is not falling, then you have to offer the diagnostic laparoscopy to your patient. The third scenario is that the beta HCG will decrease. That is, the decrease would be more than 50% in the 48 hours. So the pregnancy is unlikely to continue and most likely it will be a failing pregnancy. Still we are not confirmed. So most likely it is a failing pregnancy. So what you need to do the urine pregnancy test in 14 days. If negative, reassure the patient. If positive, to return to the early pregnancy assessment unit, that is the EPAU, in 24 hours. So this is more than enough for the pregnancy of unknown location. Only if you master this slide, then you can make all the questions from this pregnancy of unknown location right. Okay, and you can mark it very easily. A lot of EMQ for pregnancy of unknown location. It is an important topic for your talks for MRCOG too, and as well as for IMM students. If you try to build your concept from the start, it would be easy for you to clear all your exams. Thank you for watching.